Chemotherapy can destroy billions of cancer cells. Tumors shrink, scans clear, symptoms disappear. And yet, in many cases, cancer returns. Not immediately, sometimes not for years, but often enough to raise a difficult question. If chemotherapy is powerful enough to wipe out so many cancer cells, why does cancer sometimes survive at all? The answer is not about weakness, it is not about failure, and it is not about cancer being stronger. It is about how chemotherapy applies pressure and how living systems respond to pressure. Chemotherapy was never designed to find cancer. It was designed to exploit a difference. Most cancer cells divide rapidly. Most normal adult cells do not. So chemotherapy targets cell division itself. By damaging DNA, disrupting replication, or blocking mitotic machinery, chemotherapy makes rapid division unsustainable. Cells that try to divide under these conditions die. That is why tumors shrink. Not because chemotherapy recognizes cancer, but because it punishes speed. This strategy works remarkably well, as long as speed remains cancer's defining feature. But that assumption has limits. Cancer is not a single population of identical cells. It is a diverse ecosystem. Within the same tumor, some cells divide rapidly, others divide slowly. Some pause entirely. Some exist in protective microenvironments. Chemotherapy removes the most visible cells first, the fast ones. This creates the impression of success, but success here is selective. Cells that divide slowly, or not at all, may experience chemotherapy as background noise rather than a lethal threat. They are not resistant yet, they are simply not exposed in the same way. And that distinction matters. One of the least intuitive features of cancer biology is cellular dormancy. Some cancer cells can enter a state where division slows dramatically. Metabolism changes. Damage response pathways activate. In this state, chemotherapy has little to act on. No division means no target. These cells are not escaping. They are waiting. From an evolutionary perspective, this is not cleverness. It is selection. Chemotherapy removes cells that cannot slow down. What remains are cells that can. When people hear relapse, they often imagine resistance immediately. But resistance usually comes later. The first step is survival. Cells that survive chemotherapy exposure are not necessarily resistant to the drug's mechanism. They are simply the ones that were not vulnerable at the time. After treatment ends, the environment changes again. Signals return. Space opens. Nutrients become available. Cells that survived, not because they were better, but because they were quieter, now have room to grow. Only then does resistance begin to matter. From a biological perspective, chemotherapy is not a cure. It is a selective force. It reshapes the population. Just as antibiotics reshape bacterial populations, chemotherapy reshapes cancer cell populations. Cells that survive are not smarter. They are simply the ones whose traits matched the pressure applied. This is why relapse often looks different from the original cancer. It is not the same population returning. It is a filtered version. This understanding explains a key strategy in modern oncology. Combination therapies do not exist because one drug is weak. They exist because no single pressure captures all vulnerabilities. Some drugs target division. Others target signaling. Others disrupt survival pathways. The goal is not total destruction in one step. The goal is to reduce the number of escape routes. But even then, biology is not binary. Probability never reaches zero. A more accurate question is, why would we expect it not to? Chemotherapy works by exploiting a statistical advantage, not a guarantee. It reduces the population dramatically, but it does not erase variability. As long as variation exists, some cells will exist outside the primary target. This is not a design flaw. It is the cost of working within living systems. This pattern is not unique to chemotherapy. We see it in antibiotics and bacterial persistence, antivirals and latent infections, vaccines and breakthrough cases. Medical interventions rarely impose absolute control. They shift probabilities. They make certain outcomes far less likely, but never impossible. Chemotherapy belongs to this same family of tools. Powerful, precise, and deliberately limited. Chemotherapy destroys cancer cells by punishing rapid division. Cancer comes back because not all cancer cells live by that rule. Some wait. Some hide. Some survive long enough to adapt. Relapse is not evidence that chemotherapy failed. It is evidence that biology responds to pressure, not promises. Understanding this does not weaken trust in medicine. It strengthens it, because it reminds us that medicine is not about certainty. It is about navigating complexity with the best tools available. And chemotherapy remains one of the most powerful tools we have.